Welcome back to our channel everyone. Hope you all are doing good and staying safe. Today's video is about specific phobia, which is an anxiety disorder characterized by extreme fear of an object or a situation. Anxiety disorder was discussed in our last video. The link to that video is on the top right corner as well as in the description box below. We'll discuss about specific phobia in detail today, including its types, its signs and symptoms, and the treatment of choice. There are mainly 5 kinds of specific phobia, including phobia of an animal or an insect, phobia of a natural environment like water, thunderstorms, phobia of blood injection injury, phobia of a situation like airplanes, elevators, and phobia of other kinds like fear of choking, fear of loud sounds, or costumed characters. The most common specific phobias include claustrophobia, which is the fear of closed spaces, acrophobia, which is the fear of heights, arachnophobia, that is fear of spiders, driving phobia, emetophobia, which is a disproportionate fear of vomiting, and phobia of blood injection injury. Symptoms of specific phobia often include terrifying feelings of anxiety, profuse sweating, trembling or shaking, racing heartbeat, tightness in chest, choked feeling, dizziness, confusion or disorientation, and numbness and tingling sensation in either the whole body or the extremities. Now we'll discuss the treatment modalities for specific phobia, including psychotherapy and medications. As for the psychotherapy, exposure therapy, also known as systematic desensitization, is the treatment of choice for specific phobia. We tend to avoid objects or situations we are really scared of, which is quite relieving but for a short term. Avoidance can cause anxiety to worsen over time. In exposure therapy, the phobic individual is encouraged to face the feared object or situation and remain in it until the fear and anxiety comes down. The feared stimulus is either introduced in reality, through computer graphics, or presented to the phobic individual by exposing him or her to fear-evoking thoughts. Exposure is done in a graduated fashion, which is step by step. For example, an individual who fears spiders initially looks at the picture of a spider, then sees a video on it, and eventually works up to touching the insect in reality. This takes place under the therapist's supervision, and the treatment is usually divided across multiple sessions. The therapist is actively involved in modeling the exposure and teaching the individual to interact with the feared stimulus and simultaneously reducing anxiety. Usually, exposure therapy is successful in treating specific phobias, but in some situations, medications from the class of beta blockers and/or sedatives are used to treat panic symptoms like racing heart, shaking limbs, elevated blood pressure, etc. These are prescribed on a short-term basis to treat effects of phobia like severe anxiety. These medications make you feel relaxed, but for a short period of time. Therefore, exposure therapy or systematic desensitization remains the treatment of choice for specific phobia. It teaches the phobic individual to relate to his or her feelings, reactions, and thoughts and manage them in a better way so that fear and anxiety are reduced. In our next video, we'll discuss in detail about another type of anxiety disorder, which is social phobia. To stay updated and receive weekly notifications from us, subscribe to our channel and follow us on Instagram and Facebook. The link is in the description box below. You can also contact us regarding any mental health queries at the information on screen. Goodbye for now, everyone, and take care.